Hi, welcome back. So today's topic is something that is actually quite common. A lot of people have heard of it, but a lot of people don't actually know what it is or why it happens. So today I'm going to be talking about shin splints, which is also sometimes referred to as medial tibial stress syndrome or medial tibial tenoperiostitis. Now, I remember a few years ago, I kept getting kind of bruises on my shins, and I remember just sort of feeling around and feeling lots of little bumps along the length of my shin bones, and thought this was a little bit odd. And after doing some research, realised that actually, given the fact that I have flat feet and frequent bruising, on my shins, and the tendency I have for tight calves, this was all kind of adding up to one thing, that being shin splints. Now, I see many clients who complain of shooting pain along the inner tibia, which is that big bone in the leg with the shin bone, usually in the middle lower leg while out running. And quite often this, gets to the point that they actually have to stop what they're doing. So why does this happen? Okay, so obviously we know, all of our muscles, bones, nerves, all those soft tissues are surrounded by connective tissue. Now, there's something called the tenoperiostium, which basically is connective tissue that attaches, these calf muscles here to the tibia, which is that shin bone. So what happens is when these calf muscles contract and shorten, what it's doing as it shortens and contracts, it's pulling on that connective tissue. Now, if if the tension is repetitive or forceful, this will cause inflammation, pain, and shin splints. Now, the pain on the inner tibia is called medial shin splints, whereas pain felt on the outer tibia is referred to as anterior shin splints. So, who is at risk of developing this? Well, there's a few risk groups, but basically anyone who is in one of these risk groups has a chance of developing shin splints somewhere between 4 and 35% more than someone who's not in one of these risk groups. Certainly women are much more likely to suffer stress fractures from shin splints due to sort of an increase in diminished bone density, obviously once they hit menopause, and osteoporosis. People who regularly exercise, and really kind of go for it, which obviously increases the impact on the joints and things like that, they're going to be at more risk. Athletes in the early season, following a period of reduced activity, and then they're suddenly going into, high sort of, long periods of training, or athletes also who tend to train on hard surfaces, and so this is particularly applicable to runners. If you're running on like concrete rather than on, say, grass, dancers, and also military personnel. These people tend to train on harder surfaces. Anyone also who is overweight, that's obviously again going to put more impact, on those bones in the lower leg. Anyone who's previously had shin splints is going to be much more likely to develop it again. Anyone with tight calf muscles, because as we've said, if the muscle normally sort of when it contracts and shortens, it's going to pull on that connective tissue. If you've got tight calf muscles as well, that's going to pull even more on that connective tissue, causing pain. But also, I mentioned there that I have flat feet. Anyone who has foot problems, whether it's flat feet or high arches or plantar fasciitis, which I've also previously posted about, these foot problems all, contribute to, postural changes. Flat feet, for example, you're going to get overpronation of the feet, so they're going to sort of turn inwards. Quite often with high arches, you get eversion of the feet, so they kind of, sit sort of outwards. And obviously plantar fasciitis, I'm going to talk about it a bit later on, but we know that that's linked with tight calves as well. So if you have that and it's pulling down on that Achilles tendon and those calf muscles, again, it's going to be pulling on that connective tissue, that tenoperiostium. So what actually causes shin splints? As with, so many of these sports injuries, overuse and overloading the lower leg, which increases the stress on the tibia. So, this could be just due to overtraining, or it could be due to those biomechanical abnormalities that we've just mentioned, such as flat feet, for example. Sudden increase in intensity and frequency of activity level. So, we know repetitive stress increases muscle fatigue and forces the tibia to absorb most of the impact, because it's compensating for those muscles not, functioning as well as they should. And this can also cause a sort of a bowing of the tibia bone, which again is going to, increase the weakness in that area and increase the chance of injury. So in terms of muscle imbalance, we're looking at things like weak core muscles, weak hips, tightness of those lower leg muscles in the calf, and also the plantar muscles along, the foot. All of these will affect the way that the shin bone absorbs the impact. And, we know that any disruption of something called Sharpie's fibres, which connects the fascia or connective tissue around around this soleus muscle of the calf. It connects the fascia there through the tibial periosteum, and that can cause shin splint pain. So another cause is excessive eccentric muscle activity. So the tibialis anterior muscle, which is on the outer shin, sort of more towards the front of the leg, that is responsible for lifting the foot. It's the main muscle involved in lifting the foot. And so it lengthens in order to gently lower the forefoot after the heel strikes the ground. So therefore it uses muscle contraction while lengthening. So this is known as eccentric muscle contraction. Undertaking high impact exercise on hard surfaces, which I've talked about quite a lot in the past, the impact of the foot landing on hard surfaces. So for example, if you're running on concrete, this can increase muscle soreness after exercise and contribute to the formation of, chronic trigger points. So, running uphill, downhill, or even, on uneven ground will increase that eccentric contraction that we've just talked about. And therefore, this is going to have further impact on that tibia bone and the surrounding muscles. So other causes, inappropriate footwear, wearing worn out, unsupportive shoes during exercise, and especially running, will certainly increase the risk of injury and increase the impact through the joints. We mentioned at the beginning about sort of biomechanical abnormalities. So things like flat feet or high arches, wearing supportive shoes and arch supports will help the impact to be distributed more evenly, rather than, the main bulk of the impact hitting that tibia bone. Flat feet and plantar fasciitis can cause pulling of the shin tendons, and consequently promote tears, which results in inflammation. Poor exercise technique. So, things like when you're running, are you, do you have overpronation of the feet, i.e. are the ankles kind of turning inwards? This can increase stress on that shin bone and cause stress fractures, which results in a bruised feeling and bumps along that shin bone. Also we've talked about, in terms of causes, the sort of activities that are known to trigger shin pain. So things like you running, dancing, military training, these things that, are usually carried out on hard surfaces, which obviously increases that impact through that shin bone. So what are the symptoms of shin splints? Well, certainly muscle pain. This can be in one or both legs, either during or after exercise. It may be a dull or a sharp aching pain, which can occur in the front lower leg, along that inner border of the shin. Its pain may improve with rest, and it may occur usually with any activity that exerts pressure on that shin bone. Occasionally this may be accompanied by localized swelling, around that bone, and potentially even numbness and weakness in the feet as well. Obviously, stress fractures are much more likely when you have this increased impact on the shin bone, and in severe cases you may find that you start walking with a limp, There may be some inflammation of the overlying skin, muscle tightness or thickening, or as I've sort of mentioned about those sort of lumps that you can feel along the length of that shin bone. Now, there are some sort of differential diagnoses when shin splints occurs. Probably the best way, gentle. If you apply gentle pressure on that shin bone, if that recreates the pain that you're feeling, normally, and if it usually affects over 5 centimeters length of that shin bone, this is usually a good indication that you have shin splints. And while some localized swelling can occasionally occur, if you have obvious signs of inflammation or a poor pulse, or you have rapidly developing severe pain, usually on top, of those normal sort of shin splint symptoms, this would indicate that there is a different underlying cause, and you should really be seeking, medical attention. So these underlying causes can be things such as stress fractures, anterior compartment syndrome, which I've previously posted about compartment syndrome, but here we'd probably be looking specifically at that anterior compartment. Nerve entrapment, and again with that you're likely to get numbness or weakness around the feet, or popliteal artery entrapment syndrome, which is artery running through the knee. Now, there are other conditions that may be linked to shin splints. One of those we've mentioned is plantar fasciitis. Now, I'm always explaining to my clients with plantar fasciitis the importance of massaging and stretching those calf muscles, because tight calf muscles and plantar fasciitis are definitely linked. The insertion point of the tibialis anterior muscle, which runs alongside that shin bone, that can actually be palpated around the arch of the foot, and this the tendon of this tibialis anterior muscle helps to support the arch of the foot. So if the tibialis anterior muscle is fatigued or tight, then not only will arch support in the foot suffer, but it can also pull on that plantar fascia along the sole of the foot, obviously again causing pain. The other thing that's been linked with shin splints is something called Morton's neuroma, which is basically a sensitive growth that develops on a nerve between the bones of the feet, and this can then get pinched and cause pain. And these neuromas actually occur in the referral zones for tibialis anterior trigger points. So I'm going to talk a little bit about trigger points on this tibialis anterior muscle, just in just a little bit. But firstly, I want to talk about treatment. So now recovery of shin splints is really dependent on the severity, how long you've had it, what treatment is available, but generally recovery will be a few weeks to maybe a few months to really allow complete healing. rest, followed by a gradual return to exercise, building up to your previous activity level over a course of weeks. So you do need to progress slowly in order to allow the tibia to recover from, these sudden high levels of stress. And if the pain returns, decrease the activity and take it a bit more slowly. Non-steroidal anti-inflammatories, obviously, to reduce inflammation, ease pain. Cortisone injections, vitamin D and calcium supplements, especially, for women, around time of the menopause, when levels of these and absorption of these, is reduced because of the changes in hormone levels. Using cold packs to reduce any inflammation and pain levels, usually for around 10 minutes, maybe 3 to 4 times a day. Some people like to alternate this with heat packs, so you have the cold to reduce the inflammation, the heat to warm and relax the muscles. Physiotherapy, using strengthening exercises once the pain has subsided on the calves, the quads, the glutes. Sometimes exercises using a balance board as well, can be, helpful in strengthening those surrounding tissues. And of course, massage therapy and joint mobilization as well, which I'm going to go on to talk about exactly how massage can help. You may want to use some sort of compression, or certainly if you've got those biomechanical issues such as flat feet, you may want to use arch supports in your shoes or shock absorbing insoles, to offset these biomechanical abnormalities. And of course, as we said, a gradual return to exercise, starting with short, low intensity workouts. Cross training is recommended to maintain aerobic fitness. Things such as cycling and swimming, which are, good, low impact exercises, are great for if you're recovering from shin splints. Okay, so other treatment options, maybe not quite so common. There's something called extracorporeal shockwave therapy, or ESWT. This can be used for more severe shin splints, and also surgery, but that is very rare. It really is a last resort when you've been trying other more conventional treatments for sort of a year plus and they've proven to be ineffective, then potentially surgery may be an option. So in terms of preventing shin splints, standard things such as warming up thoroughly before exercising and stretching to cool down, regularly stretching while exercising, and especially stretching those calf muscles, is probably the biggest one that you need to look at. If you're a runner, running on smooth, flat surfaces where possible, and running on something like grass, to reduce the impact on the tibia and those calf muscles. If you have flat feet, use arch supports in your shoes, and use shock absorbing insoles as well, again to reduce the impact on the tibia. Using things like arch supports will really help to combat that overpronation that you can get, particularly with flat feet, but some people just tend to run with their foot in an overpronated position, and would just generally help support the arch of the foot, so that you your postural alignment will just be better. And so you won't be getting increased impact sort of in certain areas of the leg. As always, wear supportive footwear, and if you're a runner, replace your running shoes regularly, because as soon as they're becoming a bit loose, they're not supporting your foot. Massage therapy is great as a preventive measure, and also to assist with recovery when you've actually had an injury. And I will go on to talk about that shortly. But also look at your training schedule, reduce the intensity of training if symptoms start to develop. And obviously if you've previously had shin splints, you're going to be, aware of what sort of certain pain and things mean. So in terms of sort of things you can do at home as well, I haven't got it with me actually to show you, but you can get, go on Amazon or something, you can get these massage sort of roller sticks. It's literally a stick, and it has little sort of discs on it that kind of turn around. You can use that for massage of the legs, or probably, I know a lot of you out there even use foam rollers, so that as well would work, probably just as well. Really focusing again on those calf muscles, to ensure that they're not tight. But anyway, right, in terms of massage for shin splints, how can massage help? Well, obviously it can relax tight calf muscles and connective tissue. But both the front and the back, a lot of times, when you go for a massage, it may be that the therapist really focuses more on the back of the leg because that's where the main bulk of the muscle is. But you want, with shin splints, you want to be looking at the front and the back of, the leg. Because if you go in and say, oh, I've got shin splints, and they only treat the front, along that tibialis anterior muscle, this actually won't kind of help with the whole picture, and it won't help with tibial stress fractures. Massage can also, as we know, help relieve pain, help ease inflammation, but also, in terms of anterior compartment syndrome, which we mentioned compartment syndrome when we were talking about the complications earlier. Now, so this is basically caused by swelling of that anterior compartment that the tibialis anterior muscle sits in. And this is actually really, serious because, compartment syndrome can destroy muscle tissue, and it can lead to, potentially life-threatening infections. Now, this can be helped by massage, but if you have severe, rapidly developing shin pain, you must seek urgent medical attention, because if it is compartment syndrome, it needs to be dealt with, quickly. Now, there are people out there, runners, for example, who kind of have almost like a sort of a temporary compartment syndrome while they're exercising, which is nothing, particularly serious. But if you get that rapid onset of severe pain, then, do seek medical attention. So in terms of the types of massage that will help you deal with shin splints, different types of massage will have different benefits for this. So Swedish massage, for example, light to medium pressure, on the muscles, which will help to improve circulation and lymphatic drainage of that metabolic waste, taking it away from the muscles. Deep tissue massage will do a little bit more. She's still going to have that effect on the circulation, but it stretches the muscles to ease tightness. So really particularly around those calf muscles again, which will relieve the tension on that shin bone and therefore relieve pain and also reduce the formation of scar tissue that we know, builds up when you have an injury. Sports massage, again, does a little bit more. Sports massage will help also accelerate healing by reducing, the post-exercise recovery time. It also focuses on those sort of muscle tendon junctions, helping to improve flexibility and avoid the risk of injury. It will address, any muscle imbalances, and, also those biomechanical, abnormalities, which place additional stress on that shin bone. So, like your flat feet and high arches, things like that. Sports massage is great at sort of working on, those sort of compensatory patterns as well that, occur when we have these biomechanical abnormalities. Another form of therapy that is often sort of combined with sports massage is trigger point therapy. Now, point pressure may be just enough to calm down that tibialis anterior muscle in order to relieve chronic pain without irritating that whole muscle, which will then also increase the pressure in the muscle compartment, which you want to avoid. Latent trigger points in the upper third of the tibialis anterior muscle on the shin. You may find if you have shin splints, these are gonna, increase in sensitivity. Now you can actually palpate your own tibialis anterior muscle. So now what you want to do, so if we look at this one, so you've got the tibia bone, so this is the knee, you've got the tibia bone here, shin bone, and then this muscle running down the side is the tibialis anterior. So if you feel for that outer edge of the shin bone, and you'll find that along that outer edge you'll feel a thick pad of muscle, and you'll probably start to feel it about 5 centimeters below the knee, and that thick pad of muscle is the tibialis anterior, which is causing a lot of the problems here. And the trigger points really are around that top third of the muscle. These are usually very, very potent, and pain may radiate down the shin to the top of the foot when you palpate these. Now, if you feel around there and you don't feel anything, great. But you may find if you have shin splints, these are going to be particularly painful. So if you do find them, you just maintain a good pressure as much as you can sort of withstand, for 10 to 30 seconds and then off. We're not massaging, we're just pressure. And you'll find that as you maintain that pressure, the pain should ease off. And you can do that every day until, it's not a problem anymore. And then in terms of self-massage that you can do at home, obviously we've mentioned about the massage stick, or even a foam roller, using that on that thick bulk of the anterior tibialis muscle, but also the calf muscles at the back of the leg. But alternatively, you can use some massage oil and use this part of the forearm or even the heel of your hand, and you can literally just sort of slide that up the length from the foot to the knee, up the length of that tibialis anterior muscle. And you may find that in doing that, you'll actually hit those trigger points in that top third of the muscle, you know, as you come up to the top of the stroke. In terms of exercises, you want to look at focusing on strengthening the calf muscles, relaxing any tightness there, because they're the muscles that are surrounding the tibia bone. And you can find various calf stretches in a post. I haven't got it on here yet. I will be doing a post on calf muscles, but alternatively you can find that series of posts on my Instagram or Facebook pages. Just look for the Medical Massage Lady and you'll find them on there. You can also try to reduce pain by doing a couple of really basic foot exercises. So the first one is basically involves dorsiflexion and plantar flexion of the foot. So with your foot flat on the floor, you want to alternate between lifting just the toes off the floor, which is your dorsiflexion, and then lowering, and then lifting the heel off the floor, which is your plantar flexion. So you alternate the two, and then you can progress by lifting the heel off the floor and then lifting the toes at the same time. So you're doing both plantar and dorsiflexion of the foot at the same time. The other exercise you can do is dorsiflexion with eversion, which is where if your feet are flat on the floor, you sort of turn them outwards. So you can do this by basically you lift the toes off the floor and turn, literally just bring your feet outwards, so you're putting the pressure on that outer edge of the foot. And yes, so by doing these exercises, you'll be helping to strengthen that tibialis anterior muscle that runs alongside, the shin bone. Hopefully that's given you some idea of how you can manage your shin splints and also what's causing it and how you can prevent it in the future. Feel free to comment. If you have any questions, you can comment down below, or you can contact me again through my Facebook or Instagram pages. Just look for the Medical Massage Lady, and I always try to answer people's questions. But for now, on shin splints, that is really it. So I will see you next time. Take care. Bye.